Assalamu alaikum, dear student of class 9. I hope you are all well by the grace of Almighty Allah. I am Shariful Islam, your biology teacher. Today I would like to deliver a lecture on chapter 7, and this is our last lecture on this chapter. Today's topics explain the cause, symptoms, remedies and preventive measures of the disease of respiratory system. Disease respiratory system is most important for this chapter. The lungs are an important organ of respiratory system. This organ can be damaged by the infection of bacteria and virus. The lungs may be affected due to air pollution because of the presence of dust particles and chemicals. Carelessness may cause complex disease and infection. Complexities and death from common disease can be decreased by learning about causes, symptoms, remedies and prevention of common diseases of the respiratory system. This is our first disease, that is asthma. Asthma usually occurs due to overactive immunity system. The immunity system works more severely than necessary when a foreign body enters into lungs. In many cases, asthma patients have a family history of the disease. It is not a contagious or microbes-borne disease. Then we have to discuss about the cause of asthma. Certain allergic food like prawn, beef, hills of fish, etc., smoke, dust, pollen, etc., entering the lungs with the inhaling air by inhaled air can be the cause of asthma. In infants, common cold may cause symptoms of asthma. There are some exceptions of the causes of asthma, like as a seasonal variation is noted. Symptoms of asthma increase in certain seasons around the year. Now, symptoms and signs. There are many symptoms and signs of asthma disease. Some symptoms of disease are as follows. 1. Sudden increase of respiratory distress, suffocation, lip becomes blue, the veins of the neck swell, rapid deep breathing is attempt and whistling sound in the chest, as sufficient oxygen is not available in the alveolus, that results in the sufferings of the patient. Sometimes sputum may be discharged while coughing. Usually there is no fever. During inspiration, the skin between two ribs is drawn inward. Patient became weak. These are the symptoms and signs of asthma disease. When we diagnose any kind of asthma, we have to take some steps to prevent them. There is some remedy. By medical treatment, the disease cannot be fully cured, but by proper medication, improved relief may be ensured. Number 1, avoid allergies. Number 2, live in clean, well-ventilated room. Number 3, avoid using or coming into contact with items like animal fur, artificial fiber, etc. that aggravate of symptoms. Number 4, be careful and follow physician's advice. Number 5, avoid smoking, tobacco, jorda, gul, etc. And number 6, serve the patient liquid diet during breathing problem. There are some prevention of disease asthma. They are: live in hygienic atmosphere. Number 2, avoid air pollution and things that may cause asthma in the workplace or house. And number 3, always carry inhalers and medicine and take them when necessary. It is to be noted that corticosteroid treatment of this disease with high dose steroid, which gives instant relief from pain but cause long-lasting negative health consequence. This type of treatment as well as quack should be avoided. Our next disease is bronchitis. Acute and chronic inflammation of the inner lining of any part of the bronchi and bronchial tubes is called bronchitis. The disease is caused by bacterial infection, living in unhealthy condition, inhaling dust, polluted air, smoking cigarettes, and cold are some of the causes of bronchitis. Once attacked by bronchitis, there is a possibility of recurring attack. Usually, infant and elderly persons are attacked by this disease. Smoking, unhealthy environment, and pollution such as industrial dust, smokes, and the main causes of this disease. There are some symptoms about bronchitis disease. Number 1, cough, chest pain, and breathing distress. When coughing, the patient feels severe chest pain, fever, and gradual weakness, cannot eat solid food, sputum is discharged with cough. If sputum comes out with cough for continuous 3 months, and if this disease attacks consequently for 2 years, it is considered to be chronic bronchitis. There are some remedies of this disease, bronchitis. Number 1, stop smoking, drinking alcohol, use of tobacco. Follow treatment according to physician's advice. Keep the patient in tolerable temperature and dry environment. Feed nutrients liquid and hot food like as hot milk, soup, etc. and then taking full rest. There are some prevention of bronchitis like as bad habit like smoking, drinking alcohol, taking tobacco should be stopped. Abstain from working in environment with dust or smoke. Children or elderly people must not get cold. Our next disease is pneumonia. Pneumonia is a lung cancer or lungs disease. Excessive cold may cause this disease. Getting affected by cold after measles and bronchitis may lead to pneumonia. It is a dangerous disease for children and elderly people. Pneumonia may caused by a bacteria. This is pneumococcus bacteria. Pneumonia may also be caused by virus, bacteria, or fungi. These diseases may even occur enzymes or saliva gets into trachea. Symptoms of pneumonia are deposition of mucus-like liquid substance which produce cough, coughing and breathing distress, high fever and chest pain, severe respiratory distress, at the last stage whistling sound in the chest. The remedy of pneumonia is seeking timely advice from a physician and to follow the treatment given. Serving hot and liquid nutritious diet, drinking plenty of water. There are some prevention, like as number 1, to be careful that the children and elderly person are not affected with cold, live in well ventilated house, keep the patient in tolerable temperature and dry environment, and then avoid smoking. The fourth disease today's discussion is tuberculosis. Tuberculosis is a well-known airborne infectious disease. In some cases, people coming into contact with patients having skin affected by germs of tuberculosis are more likely to develop the disease. Those who work hard and weak, live in damp and unhealthy environment, suffer a malnutrition, or remain exposed to patient of tuberculosis easily become a victim of tuberculosis. Most of us think tuberculosis is only a lung cancer. This idea isn't correct at all. Tuberculosis occurs at any organ of the body such as intestine, bone, etc. Not every person infected with tuberculosis becomes very sick and the symptoms are not exposed easily. When the germs destroy white blood corpuscles, the body becomes weak, then the symptoms are exposed. There are some causes. You have to write these causes with point out. The disease is caused by Mycobacterium tuberculosis, a type of bacteria. However, some other bacteria that belongs to the Mycobacterium family may also cause tuberculosis. This germ spread in an unhealthy environment easily. How can we diagnose this disease? This disease can be found out by a sputum test, skin test that is called MT test, cyto and histopathology test, and chest X-ray. There are some signs and symptoms of this disease like weight loss, general weakness, usually cough and cold contain more than 3 weeks, coughing sometimes with blood. This is important symptom for this tuberculosis. Evening sweat and rise of low fever, chest pain, indigestion, abdominal distress. This is some sign or symptoms of tuberculosis. There are some remedies. Remedies are continued treatment according to the advice of physicians, treatment of the disease is a lengthy process. Treatment should be continued till to complete cure is achieved. Physician's instruction must be followed strictly. Patient with tuberculosis should be isolated or sent to hospital for effective and complete treatment. Keep the used belongings of the patient separately. Patient cough and sputum should be burnt in the soil. Proper treatment and adequate nutritious diet should be arranged. Without consulting the physician, medicine should not be stopped. But there is a question, how can we prevent this disease? So we have to know some prevention or preventive measures. Number one, to get rid of this disease, all children should be vaccinated by BCG. The baby should be vaccinated within 1 year after birth. Though BCG vaccination gives children protection against deadly tuberculosis, it doesn't remain effective in grown-ups. So, administering vaccination in childhood is not a lifelong protection. There is sufficient of vaccination in different health of our country. The last disease of our today's lecture is lung cancer. Among the various types of cancer, lung cancer is extensive and terribly prevented. In our country, it is the leading cause of death of male cancer patient. Smoking is considered to be one of the main cause of lung cancer. And then there is some causes of lung cancer, like as number one, lung cancer may be caused by air and environmental pollution, coming in contact with pollutants like asbestos, arsenic, chromium, nickel, solid metals, power, etc. in workplace or health or home. Number two, tuberculosis or any other pneumonia caused on type of wound that afterwards turned into cancer. And number three, it is assumed that shortage of roughage in diet increase the possibility of this disease, lung cancer. There are some symptoms and signs of lung cancer, like the sooner primary symptoms of lung cancer are diagnosed and given treatment, the more is the chance of living longer. Primary symptoms of lung cancer are found: number one, long-lasting dry irritating cough. Number two, chest pain, hoarseness of voice. Number three, gradual or day by day loss of weight, loss of appetite. Number four, asthma, frequent fever. Number five, repeatedly infected by pneumonia and bronchitis. Number six, feel pain in bones, weakness, paralysis of any gland, jaundice. This is most important things. This is diagnosis of this disease. At the primary stage, lung cancer can be determined by examining cough and sputum, X-ray of chest, CT scan, and MRI. For final confirmation, cytopathology or histopathology tests are done. There are also some remedies for this disease. Number 1, when the symptoms are found, consult the physician without any delay. After the disease is diagnosed, treatment should be taken as per the advice of the physician. Depending upon the necessity, use or apply radiotherapy. At last, the prevention of lung cancer. According to the view, preventive measures include: number 1, abstaining from smoking and drinking alcohol. Number 2, not taking excess fatty food. Number 3, regular exercise. Number 4, making the habit of taking adequate amount of vegetables. Dear student, this is our 4-5 disease of respiratory system. From this lecture, we are able to know about the causes, symptoms and remedies of asthma, then bronchitis, then pneumonia, then tuberculosis, and at last lung cancer. At the end of this chapter, there are some exercise like as what is cellular respiration, what is the function of pleura, and from this lecture, what is bronchitis, what is the function of diaphragm, what are the causes of pneumonia. And there is a essay type question: write down the symptoms of tuberculosis. There are some multiple choice. Number 1, which is the cause of tuberculosis? The main cause of tuberculosis is bacteria. Number 2, gaseous exchange in plant occur through stomata, lenticles, root hair. Gaseous exchange must be stomata is a biotic part. Lenticles or lenticels is another biotic part of plant, but root hair is not a biotic part, it is a soil part. So the answer 1 and 2. The next question: Rita went to the doctor with a complaint of weakness. Doctors informed her that she has a deficiency of a particular blood cell. To meet this insufficiency, he advised her to take more nutritious food and vegetables. The deficiency of particular blood cells is a most important line. Which one is deficient of Rita's blood? The deficient blood cell is red blood corpuscles, and that particular cells is a compound of iron, reacts with oxygen, contain carbon dioxide. And number 4, that not contain carbon dioxide is a compound of iron is correct, and reacts with oxygen is correct. 1 and 2. This is a creative question. That is, let us start with our text. Figure B and figure Q shows the exchange of gas between plant or animal. Plant release oxygen and a woman or animal receive this oxygen and he decrease carbon dioxide, and plant receive this carbon dioxide. This is the exchange of gas. First question, which cell carries oxygen in blood? Second, what is the trachea? And C, explain the process meant by P. P and Q are dependent on another in connection with gases exchange. Explain. There is another question like Rashid and Jamil works in a shipbreaking industry. Both of them called a doctor for chest pain, cough and other complaint. After different types of tests, the doctor diagnosed that Rashid's respiratory organ has irregular cell division. On the other hand, Jamil's disease has spread in intestine and bones along with respiratory organ. These are indicate the tuberculosis disease. What is the diaphragm? What is external respiration? Explain how does the disease spread in Rashid's body? And D, which one of two diseases of Rashid and Jamil comparatively easier to be cured? Analysis. I will deliver another lecture on the discussion of this creative question, and I will add some another creative question and discuss this question together. So student, no more today. In another question, we discuss CQ type question. Thank you for participating in our online class. You have to read or you have to learn this chapter properly to answer the question. There is most important chapter in class 9. So you have to practice or learn CQ question from this chapter. Today is finished. Thank you very much.